Hello and welcome. Thank you for watching my presentation. My name is Michelle Morgan. I'm a Healthy Communities Officer at Public Health Services in the Tasmanian Department of Health, and also a PhD candidate at the University of Tasmania, supported by the Australian Prevention Partnership Centre. Both my work and research are concerned with place-based approaches to chronic disease prevention, and in the past few years I've been exploring how systems thinking can be used for chronic disease prevention and the role of local government in this space. Today, I'll be drawing on what I've learned across these different areas to offer a systems thinking perspective on the governmental changes that occurred in response to COVID, the importance of place in responding to local level health needs, and why I think this disruption provides a rare opportunity to build back better for current and future generations. This perspective will draw on survey data I collected from the Tasmanian local government sector. But first, I'd like to acknowledge the Murri, Nina and Palawa people in Tasmania, who are the traditional Aboriginal owners and custodians of the lands where my work was undertaken. I'd also like to acknowledge my supervisory team, colleagues at Public Health Services, the Local Government Association of Tasmania, and the study participants for their support. I'd also like to acknowledge the Australian Prevention Partnership Centre who provided funding. There are three parts to my presentation. In the first, I'll provide some background about COVID and inequalities, non-communicable diseases and conditions, governmental responses to COVID, systems thinking and leverage points. Then I'll share data from the local government sector in Tasmania, then my perspective on why I think these insights matter. So over the past 2 years, we've all experienced and continue to experience major disruption from the pandemic, but not everyone has experienced it in the same way. The pandemic has exposed and exacerbated existing social and health inequalities, with people in areas of socioeconomic disadvantage being disproportionately affected. These inequalities are caused by the social determinants of health, which are the result of policy decisions from local to global scales. And that's because until COVID, the central goal of government systems has been to achieve economic growth, which has meant that insufficient attention has been given to addressing the social determinants of health. Non-communicable diseases are the leading cause of disease burden in Australia and globally, and will continue to be so long after the pandemic passes. However, only 1.3% of the federal health budget is spent on prevention. Compared to COVID, non-communicable diseases are a slow emergency. They develop over relatively long periods of time, and their impacts on the health system are gradual but significant. Governments have used combinations of strategies to control the spread of COVID, and this has involved taking rapid actions that shifted the system goal from economic growth to one that prioritises people's health. From a systems thinking perspective, societies can be seen as systems that are made up of many parts that interact in unpredictable ways to produce outcomes. If the outcomes of the system produces are undesirable, such as the prevalence of disease, then a systems thinking perspective can help inform decision makers about the system's many interacting factors and what parts of the system need to be changed to shift a system so it generates outcomes more desirable than those which exist. Understanding systems in this way can help various actors identify leverage points to shift the system to achieve more desirable outcomes. However, different leverage points have different levels of effectiveness, which vary from shallow leverage points, which tend to involve interventions that address immediate causes of problems, such as taxes or subsidies, and are influenced by deeper leverage points, such as goals of the system, such as economic growth. When combined with a systems perspective, understanding leverage points can help decision makers more effectively work towards the system change they are pursuing. As part of my PhD, I conducted a statewide survey of local government in Tasmania, which explored the sector's views on community health and wellbeing. As part of this survey, participants were asked about their perspective on COVID, and I'll be sharing some highlights of this today. Participants were invited to provide a qualitative response to the question, what changes did local and state governments in Tasmania make due to COVID that could be used to improve the health of Tasmanians more broadly? The survey was conducted online in late 2020, with general managers, council staff and elected members invited to participate. There were 135 participants from 28 of Tasmania's 29 councils, and 81 of those participants responded to the question about COVID. About half the survey participants were council officers and the other half were elected members. The themes that emerged from the data about the changes governments implemented were overwhelmingly positive. Continuing certain changes was advocated because they had multiple benefits. Positive changes participants wanted to see continued included the ongoing prioritisation of health and wellbeing, which included giving ongoing attention to the social determinants of health, such as through income and housing support and health in all policies. One participant said, the critical need to provide individuals with a decent living income has proven that a proper cost of living wage lessens acute financial stress and achieves better health outcomes. Participants highlighted the important role local government has for meeting local health needs and also said there was a renewed appreciation for local assets within the communities, which they wanted to continue, along with efforts to improve food security and physical infrastructure. Participants said that communication from both Tasmanian and local governments promoted whole of community unity and emphasised looking after each other, which should be continued post-COVID. One elected member said, at the state government level, there has been a genuine message of reminding people to be kind and to care for others. Politicians showing compassion and kindness can send an uplifting message that they do care about the whole community. Participants said that improved hygiene practices will reduce other illnesses, such as colds and flus, and participants advocated for flexible work practices to continue, such as online meetings, working from home, as it improved work-life balance. Having permission to stay at home when sick rather than soldier on was also a welcome change. Some participants said that the negative impacts of the changes outweighed the benefits, and these included, for example, that restrictions were in place for too long and had a negative impact on health, and that COVID was used as an excuse for community inaction. Participants' perspectives about the changes that occurred in response to the pandemic reveal parts of the governmental system that have been disrupted and are susceptible to change and affect health-related outcomes at the local level. These changes are a reminder that the rules of the system can be changed and shape the conditions that affect population health outcomes, whether they relate to the ongoing threat of COVID or the slow emergency of non-communicable diseases. All tiers of government in Australia have power and influence to change these rules, and each tier need to prioritise achieving a high standard of health for all to the same degree that is given to promoting economic growth. The same prioritisation must also be given to planetary health because there is no public health without planetary health. The disruption caused by COVID resulted in change to a deep system leverage point. The goal of the system changed from economic growth to prioritising people's health. This disruption provides an opportunity to reassess collective priorities and change entrenched system behaviours to build back better for current and future generations, and should include prioritising human and planetary health on par with economic growth. And what that might look like is to have a system goal of a well-being economy. Globally, the vision of a well-being economy is gaining traction, which is an economy that is designed with the purpose of serving the well-being of people and the planet first and foremost. And in doing so, it delivers social justice on a healthy planet. Countries such as New Zealand and Wales are championing this vision. These countries have reframed whole of government actions on the central organising principle of well-being through budget and legislative mechanisms. In Australia, ACT's wellbeing framework and Victoria's analysis of legal and policy measures to achieve sustainable development in Australia are leading the way. In Tasmania, the timing is right to pursue a wellbeing economy. The new Healthy Tasmania plan perhaps offers an important precondition to work towards a wellbeing economy. Some other significant opportunities to pursue a wellbeing economy in Tasmania include the current state service and local government reviews. Unless such efforts for change are taken, poor health outcomes and health inequities are likely to be exacerbated in the longer term. Before I sign off, I'd like to leave you with some questions for you to reflect on what you've heard from my presentation today. What are the opportunities to maintain the benefits gained from COVID from where you stand? What did you hear today that was new, surprising, or powerful for you? What, if anything, will you do differently because of what you've heard today? Thank you for listening. Please get in contact if you'd like to discuss what you've heard today further.